Hello and welcome to this travel episode with me, Nyasha K. Mutizwa. Now, when former Zimbabwean President Robert Mugabe died at a Singapore hospital, he joined a number of African leaders who left their countries to seek medical treatment overseas. Mugabe had been receiving treatment at a in the Southeast Asian country for years. When he left Zimbabwe in May this year, it was believed that he would be there only for a few weeks. However, he never returned home and died on September 6. Robert Mugabe is not the only African leader to shun his country's own hospitals and engage in what is known as political health tourism. Take a look.
It is well documented that politicians from across the continent travel abroad for medical treatment. In 2017, Muhammadu Buhari infamously went to the UK for medical treatment for a period of 4 months, outraging Nigerians and breaking his election pledge to end medical tourism. Benin President Patrice Talon flew to France in May of the same year for almost a month to treat an undisclosed illness in Paris, France. Ali Bumbu, President of Gabon, suffered a stroke and was rushed to the hospital in Saudi Arabia on October 24, 2018. He also underwent regular treatment in London following a deterioration of his health. Some African leaders have found death on their journey to get healthy. Zambia's Livy Mwanawasa died in France, while the country's Michael Sata passed away in the UK. Then there was Guinea-Bissau's Malembasi Sanha, who died in France, Ethiopia's Mali Zenawi, who died in Belgium, and Gabon's Omar Bongo, who died in Spain. A few fortunate ones made it home, but died shortly afterwards. They include Nigeria's Musa Yar'Adua, who died in Abuja after returning from treatment in Saudi Arabia, and Ghana's Atta Mills, who died in Accra after returning from a brief medical spell in the United States.
Now, countries pay a heavy cost for this behavior. It's estimated that in Uganda, the funds spent to treat top government officials abroad every year could build 10 hospitals. Not only do the leaders travel with elaborate entourages, but they also travel in expensive chartered jets. For example, the cost of parking Buhari's plane during his spell in London in 2017 is estimated at £360,000. The deteriorating healthcare system in Africa has popularized medical tourism for the average citizen as well. In 2016 alone, Africans spent well over $6 billion on medical tourism, with Nigerians accounting for over $2 billion of those dollars. Professor Kama Rogo of the World Bank says 25% of the passenger loads on major airlines such as Kenya Airways and Ethiopian Airlines are medical tourists. Interestingly, Africa has a $1 billion medical tourism market, and the involvement of these African leaders through partnerships could be the key to accentuate it. Indian healthcare entrepreneurs and investors are already making significant moves to corner Africa's medical tourism market by branching into the continent. Apollo Hospitals, India's biggest healthcare chain, is investing in a $70 billion 500-bed hospital in Dar es Salaam. The multi-specialist facility is intended to serve patients and would-be medical tourists in the East Africa region. Another Indian medical company, BioHealth, is investing $5 million in a health facility on the continent for comprehensive cardiology, dialysis, and radiology. So to bring change, African citizens must start condemning political medical tourism. They must also push for regulations to curb the practice. Taxpayer-funded medical trips should be banned, and criteria should be set detailing what sicknesses can be covered by the public purse. Whether or not they are medical tourists themselves, African leaders should muster the political will to improve the healthcare systems in their respective countries. Let me know what you think about this on social media at Nyasha K. Mutizwa. Let's talk about this. Thank you for watching. Until next time.